Hypoxemia is a critical health condition marked by insufficient oxygen levels in arterial blood and poses significant challenges to bodily functions. This state not only disrupts the essential supply of oxygen to tissues and organs, but also signals underlying respiratory or circulatory issues. This video provides a concise overview of hypoxemia, outlining its causes, symptoms, diagnosis, and potential treatment options. So keep watching to learn more. As previously mentioned, hypoxemia refers to a lower than normal level of oxygen in your blood, specifically in the arterial blood. Oxygen is essential for the cells in the body to function properly, and blood oxygen levels are an indicator of how well oxygen is being distributed throughout your body. The condition is often detected through a blood test or a non-invasive device called a pulse oximeter, which measures the oxygen saturation of the blood. Normal blood oxygen levels are typically between 95% and 100%. Values below 90% are considered low and can be indicative of hypoxemia. Now, let's talk about the signs and symptoms. Hypoxemia manifests through various signs and symptoms that can range from mild to severe, depending on its underlying cause and severity. Individuals with hypoxemia may experience shortness of breath, especially during physical activity, or even at rest in more severe cases. A feeling of breathlessness or difficulty breathing is also common. Cyanosis, a bluish discoloration of the skin, lips, and nail beds, is another telltale sign indicating insufficient oxygenation. Rapid heartbeat and palpitations are often present as the body attempts to compensate for the reduced oxygen supply. People suffering from hypoxemia might also exhibit confusion, disorientation, or a sense of unwellness due to decreased oxygen delivery to the brain. In severe cases, there could be a significant impairment in cognitive functions, including concentration and memory. Additionally, those with chronic hypoxemia might experience fatigue or weakness, finding themselves easily tired out by activities that were previously manageable. It's important for anyone experiencing these symptoms to seek medical attention, as hypoxemia can lead to serious health complications if left untreated. Hypoxemia can result from various underlying conditions, each affecting the body's ability to oxygenate the blood efficiently. The 5 primary causes include hypoventilation, VQ mismatch, shunt, reduced diffusing capacity, and altitude. Hypoventilation occurs when inadequate breathing leads to insufficient oxygen intake and carbon dioxide expulsion, disrupting the balance of gases in the blood. Ventilation-perfusion mismatch is another significant factor, where disparities between the air reaching the lungs and the blood flow in the lungs' capillaries impair gas exchange. This mismatch can be due to a variety of reasons, including lung diseases that affect airflow or blood flow. A shunt refers to blood that bypasses the lungs entirely, moving from the right to the left side of the heart without being oxygenated, as seen in certain congenital heart defects or severe lung conditions. Reduced diffusing capacity is another cause, where the lungs' ability to transfer oxygen from the air sacs into the blood is diminished, often due to damage or thickening of the alveolar capillary membrane, as observed in fibrosis or emphysema. High altitude can lead to hypoxemia because the lower atmospheric pressure reduces the oxygen available for inhalation, making it harder for the body to obtain adequate oxygen levels. Each of these conditions can, independently or in combination, lead to the reduced oxygenation characteristic of hypoxemia, necessitating varied approaches to management and treatment. The diagnosis of hypoxemia involves a multifaceted approach to accurately measure blood oxygen levels and identifying the underlying cause of reduced oxygenation. A primary diagnostic tool is the arterial blood gas analysis, which provides precise measurements of oxygen, carbon dioxide, and blood pH levels. This test is instrumental in assessing the severity of hypoxemia and the body's response to low oxygen levels. Pulse oximetry is another commonly used non-invasive method that estimates the oxygen saturation of hemoglobin in the blood through a sensor placed on a thin part of the patient's body, usually a fingertip. While pulse oximetry is convenient for continuous monitoring and initial assessment, it may not be as accurate as ABG in certain conditions. To pinpoint the cause of hypoxemia, healthcare providers often rely on imaging studies like chest X-rays or CT scans, which can reveal structural abnormalities, areas of lung consolidation, or other changes indicative of conditions that might impair gas exchange. Pulmonary function tests are also useful in evaluating the lungs' capacity to move and exchange air, helping to identify restrictive or obstructive lung diseases. In cases where a cardiac origin is suspected, an echocardiogram may be performed to assess heart function and detect abnormalities that could lead to shunting or other forms of hypoxemia. Together, these diagnostic tools allow for a comprehensive evaluation of hypoxemia, guiding treatment plans tailored to the specific needs of the patient. Treating hypoxemia involves addressing both its immediate effects on oxygen levels in the blood and its underlying causes. The primary goal is to increase oxygen delivery to the tissues, which is often initially managed through supplemental oxygen therapy. This can be administered in various forms, from nasal cannulas to face masks, depending on the severity of the oxygen deficit and the patient's specific needs. For those with severe hypoxemia or difficulty breathing, mechanical ventilation may be required to ensure adequate oxygenation and carbon dioxide removal. Beyond these immediate interventions, treatment plans must also tackle the root causes of hypoxemia. For instance, medications such as bronchodilators, corticosteroids, or diuretics may be prescribed to manage conditions like COPD, asthma, or pulmonary edema, respectively, which can contribute to impaired gas exchange. In cases of hypoventilation due to neuromuscular disorders or obesity hypoventilation syndrome, interventions might include weight loss strategies or devices to support nighttime breathing. For hypoxemia caused by high altitude, acclimatization or descending to a lower altitude may be recommended. Moreover, patients with chronic conditions may benefit from pulmonary rehabilitation to improve lung function and overall quality of life. The treatment approach is highly individualized, taking into account the specific causes, the patient's overall health, and the presence of coexisting conditions to effectively manage and alleviate hypoxemia. We also need to discuss refractory hypoxemia. Refractory hypoxemia refers to a severe condition characterized by persistently low levels of oxygen in the blood that do not adequately respond to standard oxygen therapy, including increased concentrations of inhaled oxygen. This form of hypoxemia is particularly concerning, as it is often seen in acute and critical conditions such as acute respiratory distress syndrome, where the lungs' ability to oxygenate blood is significantly compromised. The hallmark of refractory hypoxemia is its resistance to treatment. Despite administering high levels of supplemental oxygen, the patient's arterial oxygen levels remain dangerously low. The pathophysiology behind refractory hypoxemia often involves severe damage to the lungs' alveoli and capillary membranes, leading to significant impairment in gas exchange. This can be due to various underlying conditions, including severe pneumonia, sepsis, or trauma, which induce inflammation and fluid accumulation in the lungs, further exacerbating the difficulty in oxygen transfer from the air to the blood. Managing refractory hypoxemia requires more advanced therapeutic strategies beyond standard oxygen supplementation. These may include mechanical ventilation with higher levels of PEEP to keep the alveoli open, prone positioning to improve ventilation-perfusion matching, or even extracorporeal membrane oxygenation as a last resort to oxygenate the blood outside the body when conventional methods fail. The challenge in treating refractory hypoxemia lies in not only improving oxygen levels, but also addressing the underlying cause of the severe gas exchange impairment, making it a complex and critical condition that demands immediate and intensive medical intervention. But, as previously mentioned, hypoxemia is a critical condition characterized by lower than normal levels of oxygen in the blood, posing significant risks to overall health and organ function. Understanding its causes, recognizing its signs and symptoms, and undergoing timely diagnosis are crucial steps in managing this condition effectively. Treatments for hypoxemia vary widely, from supplemental oxygen and medications to lifestyle changes and addressing underlying health issues, highlighting the importance of a personalized approach to care. Awareness and education about hypoxemia can empower individuals and healthcare providers alike to take early action, potentially preventing the severe consequences of prolonged oxygen deprivation. If you want to support the channel, please like and subscribe. I would greatly appreciate it. And there should be some other helpful videos popping up on your screen right about now that I think you will enjoy. And just a quick reminder, we are not doctors. This video is for informational purposes only. Thank you so much for watching, have a blessed day, and as always, breathe easy, my friend.